students. Welcome back to our YouTube channel Denteasy. Let's make dentistry easy with Denteasy. In today's lecture, we shall be discussing about the phases of tooth movement, the phases or stages of tooth movement. As we know, whenever a certain set of force is applied on a tooth structure, then the tooth movement takes place. It occurs in different phases or there are different stages in which the tooth movement takes place. It's not like that on the very first day itself the tooth moves itself. No. So the various stages which have been described by Burstone, it has been listed as initial phase, which is also called as the displacement phase. Number two is the lag phase, also called as delay phase. And number three is the post lag phase or acceleration or linear phase. So we shall be discussing about all these phases one by one. Let's get started with the initial phase. As we know, initial represents itself, the literal meaning is the starting of the tooth movement. This is the very first stage immediately following the force application. That is the phase in which the rapid tooth movement takes place and a sudden displacement of the tooth is seen within the tooth socket. The sudden displacement is the key word here. If we look at the diagram, here, as we know, this is the crown and the root portion, the pedial fibers, and the alveolar bone. Whenever a certain set of force is applied onto the tooth structure, could it be heavy or the light force, depending upon the force, then the tooth movement takes place. Now, in the very first or the initial phase, what is seen is whenever force is applied onto the tooth structure, the tooth moves within the pedial space. As you can see here, two sides have been described. One is the tension side, another one is the pressure side. Whenever some force is applied, the tooth moves within the pedial space itself. So, whenever some force is applied, there must be some kind of physiological response which can be noticed into the tooth movement. So, in that case, in less than 1 second, what type of physiological changes takes place? In that time, this pedial fluid, the pedial fluid is incompressible. It means that cannot be compressed itself. But what happens is there are certain piezoelectric signals which are being generated. So those signals they lead to the initiation of alveolar bone bending. We have discussed this in the biology of tooth movement in that lecture in detail. So that is seen in the initiation phase in less than 1 second. But in the next 2-3 seconds, this PDL fluid is compressible and the PDL fluid is expressed and the tooth moves within the PDL space itself. Now, there is another thing. There are certain kinds of blood vessels which are present in the PDL space. The blood vessels within the PDL, they are partially compressed in the initial phases of tooth movement, which leads to the slight cells mechanical distortion. The cells are a little bit distorted in that case. So this was all about the physiological changes being taking place in the tooth movement in the initial stage. Let's give a look at the graph also. When we plot a graph between the tooth displacement calculated in millimeters to the stages of tooth movement, initially in the first 3 days, in 1 to 3 days, the slight tooth movement is seen, which is very quick and rapid in nature and which is said to be zero point 0.4 to zero point 0.9 millimeter within the week's time. So the next stage is the lag phase. The lag phase is the one in which little or no tooth movement takes place. This is because of the hyalinization. As we have discussed in the previous lecture also about undermining resorption or the hyalinization. I'll give you a quick review of that here also. And the duration depends upon the amount of the force which is used to move the tooth. So basically, in the lag phase, whenever the heavy forces are being applied to the tooth structure, in that case, the pedial fibers, these are completely compressed along with the blood vessels which are completely occluded, which ultimately leads to the insufficient blood supply. And there are certain set of metabolic changes which can be seen in this stage. These may include the prostaglandins release or the cytokine, which can be released in this phase, which ultimately leads to the cellular differentiation within the PDL itself. Now, in this case, we know as the blood vessels, these are completely occluded in this case, and the certain metabolic changes which are seen, which leads to the increased osteoclastic activity here on the pressure side of the tooth, which ultimately lead to the metabolic changes, and the resorption which is seen is the undermining resorption. As we know, the undermining resorption takes longer time to recover itself from the trauma which the tooth has faced itself, and it occurs because of one thing which is termed as hyalinization. So before further tooth movement, it has to recover itself from the hyalinization, or you can say the necrosis is seen along the tooth surface. To clear that necrosed area, it takes longer duration. We can see that on the graph itself. So in the lag phase, we can see here the undermining resorption is seen. It takes 2 to 10 days and it takes time to recover itself. So, this is the phase in which no tooth movement is seen, little or no tooth movement is seen. So, this was about the second phase, which is the lag phase. Let's proceed to the next phase, and which is the post lag phase or the acceleration or the linear phase. As we have discussed previously, that for the hyalinized area to clear itself, it takes time. Whenever the hyalinized area is cleared, after that, the rapid tooth movement is seen because the necrosis has been cleared away by the body's physiological process, and so the and the tooth movement is seen in that cases, which is rapid in action. The duration depends upon one is the density of alveolar bone, number two, the age of the patient. Like as we know, the younger patients they have the higher potential to fight with any kind of immune response. So in that case, age of the patient plays its role. And lastly is the extent of the hyalinized tissue. More the forces have been applied to the tooth structure, more will be the hyalinized area, more time it shall take to recover back to the normal position. So these are the various factors on which the post-lag phase depends. And if we look at the physiological process, in that case, the tooth movement begins because osteoclast and osteoclastic activity, it has almost remodeled the bony socket. So the remodeling has been taken place by the osteoclastic and osteoblastic cells. So in that case, the tooth movement begins. And we can see this in the graph itself that the tooth displacement is more as the hyalinized area has been cleared away. So this is the post-lag phase. That is why this is called as the acceleration phase or the linear phase, because here the tooth movement is more, which is linear in action, or which is the accelerated after the clearing of the hyalinized area. As we know, the duration is different for the post-lag phase, but it is usually said that the lag phase can extend from 2 to 3 weeks, but it may be as long as the 10 weeks duration. So depending upon the amount of the force which have been applied to move the tooth, basically on that behalf, there are three different but overlapping stages of tooth movement which have been seen and described by Burstone. So this was all about the stages and phases of tooth movement. If you liked the video, please like, share and subscribe and stay tuned. Thank you.